This vaccine is used to help prevent infection from the hepatitis B virus. Hepatitis B infection can cause serious problems including liver failure, long-term hepatitis B infection, cirrhosis, and liver cancer. Preventing infection can prevent these problems. The vaccine is recommended for people of all ages, especially those at an increased risk of getting the infection. Those at an increased risk include healthcare personnel, lab workers who handle blood and patient specimens, police, fire and emergency medical personnel who give first aid treatment, hemophiliacs, dialysis patients, people who live with or spend much time with people with long-term hepatitis B infections, people with multiple sex partners, men who have sex with men, sex workers, injection drug abusers, and people traveling to high-risk areas. The vaccine works by helping the body produce immunity that will prevent you from getting infection from hepatitis B virus. Hepatitis B vaccine does not protect you from other virus infections. Vaccines may not fully protect everyone who receives them. Before receiving the Engerix-B Pediatric-Adolescent Vial vaccine, make sure to read all the information from your healthcare professional. If you have any questions, don't hesitate to ask. This vaccine is typically given as an injection into a muscle, such as the shoulder or thigh, by a healthcare professional. In some cases, it may be given as an injection under the skin if you have a bleeding disorder. Your healthcare professional will provide you with a vaccination schedule, usually consisting of 2 to 4 injections, which you must follow closely for the best effectiveness. If you have a fever or illness at the time a vaccination is scheduled, your healthcare professional may decide to delay the injection until you are feeling better. The dosage and vaccination schedule will be determined based on your age, medical condition, risk of hepatitis B exposure, and the brand of vaccine being used. If you are receiving the first hepatitis B vaccine injection at a time when your healthcare professional thinks you may have been exposed to hepatitis B, you may also receive an injection of hepatitis B immune globulin, HBIG. HBIG contains antibodies against the virus and will immediately help protect you from developing an infection. However, these antibodies only last a few months. For long-term protection, it is crucial to follow your vaccination schedule for the hepatitis B vaccine exactly. Some common side effects of Engerix-B Pediatric-Adolescent Vial may include pain, soreness, redness, swelling at the injection site, fever, headache, tiredness, sore throat, nausea, diarrhea, loss of appetite, and dizziness. If these effects persist or worsen, it's important to seek advice from your healthcare professional. In rare cases, people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears after receiving the vaccine injection. If you experience any of these symptoms, it's important to notify your healthcare professional immediately. Sitting or lying down may help, as these symptoms usually do not last long. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. A serious allergic reaction to this drug is rare, but if you notice any symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your healthcare professional if you notice any other effects not listed above. If you have any concerns or questions about the side effects of Engerix-B Pediatric-Adolescent Vial, it's important to reach out to your healthcare professional for medical advice. Before receiving the Engerix-B Pediatric-Adolescent Vial, make sure to inform your healthcare professional about any allergies you may have, as this vaccine may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history, especially if you are currently ill with a fever or if you are a hemodialysis patient. Hemodialysis patients may not respond as well to the vaccine and will need to have their hepatitis B antibody levels checked yearly. If your antibodies drop too low over time, you may be given another dose of the vaccine. If you have immune system disorders, such as HIV infection or certain cancers, your body may not make enough antibodies to protect you from hepatitis B infection. Your antibody levels may need to be checked after completing the vaccine series. Older adults may not produce as many antibodies to the vaccine, so it's important to discuss this with your healthcare professional. During pregnancy, this vaccine should only be used when clearly needed, so be sure to discuss the risks and benefits with your healthcare professional. It is also unknown if this vaccine passes into breast milk, so consult your healthcare professional before breastfeeding. It's important to be aware of potential drug interactions that can affect how this vaccine works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your healthcare professional. This includes prescription and non-prescription drugs, as well as herbal products. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with Engerix-B Pediatric-Adolescent Vial include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. While other vaccines may be given at the same time as the hepatitis B vaccine, they should be administered with separate syringes and at different injection sites. Remember to follow your doctor's instructions regarding the timing and dosage of this vaccine. This vial is used to help prevent infection caused by the hepatitis B virus. It works by causing the body to produce its own protection, antibodies, against the virus. It's important to note that no vaccine can guarantee complete protection for everyone who receives it. Your doctor may conduct lab or medical tests, such as checking hepatitis B antibody levels, while you are using this medication. It's important to attend all medical and lab appointments and consult your doctor for more details. Keep a record of all vaccines for yourself and your children. When your children are older, provide them and their healthcare professionals with their vaccine records to avoid unnecessary revaccinations. Make sure to follow the vaccination schedule for Engerix-B Pediatric-Adolescent Vial as recommended by your healthcare provider. It is important to receive each dose as scheduled, so be sure to ask your healthcare provider about the timing for each dose. You can also keep a note on a calendar to help you remember the schedule for receiving the vaccine. Remember to store Engerix-B Pediatric-Adolescent Vial in the refrigerator, but make sure not to freeze it. It's important to keep all medications away from children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. You should properly discard this product and it is expired or no longer needed. It's always a good idea to consult your pharmacist or local waste disposal company for guidance on the proper disposal of medications. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.